Good evening and welcome to RFL. I'm Richard French. Well, tonight we're going to make you at home a big part of our program. What we're going to do is we have on set with us an emergency room doctor who is ready to take your questions about COVID, and I can certainly understand if you have a few. Phone lines, we've opened them up right now. In fact, the toll-free number right there on your screen, 888-766-2428. Spells out phonetically to 888-RNN-CHAT. Again, those phone lines are open. We'll get to those calls shortly. You can also get involved online. Send us an email. You see it right there, rfl@rnntv.com. We'll get your questions and comments online as well. Okay, tonight we are going to take a look at the medical aspects of COVID, and we're also going to be discussing the economic impacts it's having and where we go from here and what is going to happen. And tonight we'll take a look at the world of sports. And for that, I'll be joined by baseball super agent Scott Boras, and also the head coach of the St. John's men's basketball team, Mike Anderson, for the professional and the amateur perspective of when we can get back to some kind of normalcy, and if we do, what will it look like? But before we get to any of that, I want to bring in our senior political correspondent, Andrew Whitman. He's got the very latest news and headlines. Andrew?
Well, Rich, today is May 1st. It's a day that many states had targeted as pivot points for reopening. A bunch of states, the one we're showing in orange, are reopening with wide groups of businesses, most with restrictions on crowds and occupancy, and some requiring or advising protective measures. Texas is the only state in which we broadcast that's among them. Now, the states that are shown in yellow are easing restrictions or are reopening only in specific places. That includes Pennsylvania. 1 week from today, parts of Pennsylvania will reopen with restrictions, but only in the northwestern and north central parts of the state, not in the Philadelphia region or eastern PA. Texas is allowing a wide range of businesses already to reopen, including stores, malls, restaurants, and movie theaters, but it's capping occupancy at 25% of capacity. Same with museums and libraries, but they can only open with the permission of local governments. Churches and houses of worship can open if they follow social distancing rules. Worth noting, Texas is one of the states threatening to block workers from getting unemployment benefits if their workplace reopens but an employee refuses to go back, even if fears of contracting the virus are why they're staying home in the first place. I want to tell you also that a number of states where we're now seeing are also allowing people to play golf. It's a county-by-county decision in California, but golfers in all these other states can go out and hit the links. Worth noting, even as these states open back up, the public says they're not as eager as politicians are. 65% of all Americans say it's a bad idea to have to return people to work right now until testing shows we can keep people safe. 8 in 10 say it's a bad idea to open restaurants. 85% say opening schools is a bad idea, and more than 9 in 10 say it's a bad idea to attend a large sporting event. There are no more worries about schools reopening in New York. Governor Andrew Cuomo today canceling the remainder of the school year across the Empire State. It's a move that impacts K through 12 students and colleges as well. Elsewhere, still more head scratching after yet another mystifying statement from President Trump yesterday.
Our death totals, our numbers per million people are really very, very strong. We're very proud of the job we've done.
But as he was saying that and other similarly reassuring things, Trump's administration was quietly buying 100,000 new body bags and 200 refrigerator trucks to store corpses of COVID victims. The order was placed the day after Trump said the U.S. death count might not pass 60 or 70,000. It already has. As of 3 p.m. Eastern, we were over 63,000 COVID deaths and more than 1 million confirmed COVID cases. And data from the CDC now suggests a massive undercount of COVID deaths in the U.S., perhaps by as much as 50%. Now, if the death count is 50% higher than the official tally, that would bring the total to more than 96,000 Americans' lives lost. Finally, I began this report noting that today is May 1st, a key day for states reopening. And of course, for millions, it is also the day that rent and mortgage payments are due. Analysts are now bracing for a wave of evictions and foreclosures as people impacted by the virus and by the plummeting economy fail to make their payments. Some states have blocked all evictions for a time, but they're a minority. Another problem, people who bought additional real estate as rental properties, but no one's renting out Airbnbs right now either. Rich?
Thank you very much, Andrew. And again, a reminder, everybody, get on the phone lines now and you can pose your questions. And if you have a comment, you see the number right there on your screen, 38766-2428. Again, we have Dr. Pena here to help us get this. He is an emergency room physician for Northwell Health System. He's also the system's director of global health. Doctors, always thank you. And it goes without saying, thank you and all the other folks in the front lines for what you're doing. And I think that there is a misconception that maybe because we're on the right side of the curve, that somehow we've returned to normalcy. And if only that was true.
Yeah, I mean, unfortunately, not much has changed about our susceptibility to this virus and our immunity to it. So unfortunately, as we've seen the numbers drop, we have to understand that's a direct effect of our actions. And when we reverse some of those actions, we're going to see an effect in viral numbers. We're going to see new infections go up, no matter what we do. The idea is that if we do it in a controlled way, when the time is right and we have testing, that we may be able to limit the impact of relaxing some of those restrictions.
And while certainly if I walked into your emergency room, it doesn't look like what the peak looked like, you still have a lot of cases, right?
Yeah, so in the emergency departments, we're doing a little bit better, but definitely in the hospitals right now, we still have tons of patients either on ventilators or recovering in medical wards. The scary thing actually is the ERs are actually a little bit emptier than we would expect them to be at this point right now, at least in New York. And it seems like all of the other emergencies have disappeared as well. So the strokes and the heart attacks and all the things that really shouldn't be changing have gone dramatically down, which makes me concerned that people are having these events at home and are going to have worse outcomes because of it.
We're going to get to a lot of the calls, as we always do with you. Thank you so much for that. But and I want to talk about the vaccines a little bit later in the program with you. And I am going to do a very macro and not as nuanced approach given the time limitations. But it seems, listen, we would all love that there were to be a vaccine that magically drop, down tomorrow. Manna from heaven, we solve all our problems here. We just have to take this, and this is beyond us. There is no historical method to say that we should expect one this year, let alone any time around the corner. Then that begs the question, if we do want to open our doors, and Andrew went into all the states that already are in some version or another, we at least need to know testing. We have to be able to have the capacity to test and then to trace. Let's start off with the testing. There's so many more moving parts than I think the layperson understands that goes into having a test that's both functional and useful. We're hearing things like reagents, et cetera. As best you can to explain to the audience what is important to have in a test that's useful so that you can have data that you then can follow.
Right. So the components of the test really are accuracy. So when a test is negative, we want to know that it's truly negative, that that patient does not have the virus, cannot transmit the virus, and that when a test is positive, it's truly positive. So those are the kind of the characteristics of the test itself. And then it becomes the ease of the test getting done, which often translates to how long the person after doing the test has to wait for that result. And then the last part is the availability of that test at all the places where you'd want to test people.
A perfect example is the governor of Maryland couldn't wait on Washington anymore. Governor Hogan literally worked out a deal with South Korea where he met at the airport. He literally had the Maryland National Guard because he was afraid, the feds were going to abscond some of it like they did with the ventilators. But now that he's got all these kits, he doesn't have some of the elements to make them functional. We're learning terms like reagents. Can you explain why it's not just physically having a test, but you need parts that really the federal government has to provide to make them functional?
Right, and some of the simplest things, like even the swab that goes deep inside the nose to the back of the throat, is something that's in short supply right now. So that's the easiest thing I think for the layperson to understand. But when you're thinking about this, you're trying to detect the RNA, the genetic code of the virus, amongst all the other things that exist in the environment. And in order to do that, you need very special chemicals, enzymes, in order to replicate that small amount of RNA that's on that tip of that Q-tip so that it's detectable by a machine. And so that requires all of these different enzymes, chemicals, and reagents to cause the reaction to happen. It's called a polymerase chain reaction, or PCR.
And I intentionally don't like dragging you into politics. I'm not going to tonight. But the idea that 50 individual states or territories, right, could individually get all these moving parts to have this, it doesn't work that way. The supply chain, for efficiency but practically purposes, it's got to come from the federal government. There has to be a coordinated effort. You can't just have, like we saw with the ventilators, it just doesn't make sense, right?
Things always happen better when they're coordinated. And having any number of entities, even if you broke it down by the state level, if you had multiple entities vying for a small pool in New York State, that doesn't work for us either. And so you need to have a coordinated effort.
Now, the volume of tests, it makes sense. People want to come back to work. You got to know that they're not positive, that you need to take a test. Then on top of that, practically, I'm hearing people say, then you need to keep retesting these people, because just because they weren't positive on Monday doesn't mean they couldn't have come in contact with somebody 2 days from now, every 2 weeks, 4 weeks, whatever it is. We need a huge volume of tests here if we want to get back to normal, if we want people to go back to work, if we want people to go sit in restaurants. That's a non-starter. If you don't have that, you can't do it, right?
Right. I mean, essentially what you want to do is to make sure that the earliest sign of symptoms that are consistent with COVID-19, that you're able to test that patient and determine whether they're infectious. And if they're infectious, they need to go back to social distancing and isolating at home. And that's the only way this is going to work. We need to wait until the numbers go down enough that we don't have widespread community transmission. Yep. So that's an important piece. You have to rewind to January, February. And then once you do that, when you're able to test individual people and isolate them, then you can prevent that widespread transmission from happening again.
And that's why we're talking tens of millions, if not hundreds of millions of tests here to practically do this. Now we get to what was announced in New York, and obviously it's not limited to New York, but Governor Cuomo and with the former Mayor Bloomberg, they were talking about tracing and bringing on somewhere in the neighborhood between 10 and 15,000 tracers. From, again, in my very basic way of describing it, and correct me if I do it wrong, this person would be able, if there was a positive test, to basically act as a detective to figure out the circle or whatever, concentric circles you were around, and figure out, well, if we tested you this, I'm going to go back X number of days and figure out all the possible people you came in contact. If you can't do that, doctor, then you can again contain spread, right?
Correct. Yeah, again, and you need the numbers to be low enough at the start that it actually makes sense to be able to do this. But the idea is, if you get down to just sporadic cases again, then you can trace that person's contacts and prevent the secondary spread from people that positive patient came into contact with over the past few days before they realized they were infected. And those two things work hand in glove.
All right, I see a lot of people wanted to talk to us on the phones. We're going to get into the idea of a vaccine and what the realistic expectation for our audience should be in terms of when we'll see one throughout the program. All right, we'll take a quick commercial break. We come back. I'm going to bring you into our conversation, everybody. You know our number. It's there on your screen. We'll get to your phone calls. Also try and squeeze in an email or two as well here. Your reaction and Dr. Pena after this.